My background, my training is as a behavioral scientist. I'm a public health researcher, and my work focuses on behavioral cancer prevention with a strong emphasis on tobacco prevention and cessation. We also had a number of neat opportunities that probably would not be available outside of the fellowship to meet with people like the Secretary of Health and Human Services. Those kinds of things were kind of scheduled and peppered in along the way, which were made it very unique in our opportunities that probably, in my career, I can't think of another place where I would have that chance to do that. I'm a researcher, and so being able to, email someone at one of those agencies is really a rare luxury, I would say, especially, when, they know who you are, they know the kind of work you're doing, they're really familiar with your science and the skills that you have, and so making those connections is really, I would say, invaluable from a career perspective. Now I'm kind of thinking about the research questions differently because you approach it as though, what kind of question is relevant to this idea of improving public health at the population level versus, maybe a clinical population, for example, in a subgroup. The FDA is in an important position to make a huge impact on tobacco use and the related death and disease, and so being a scientist who can inform that process is exactly what I had hoped to gain from the fellowship in the first place.